Over to you, and your time starts now.
Good afternoon, everybody. I'm Dr. Ekta. I come from Department of Anesthesia, Christian Medical College, and we keep auditing our practice. And this is one of the audit I'm going to present in front of you today. And the topic for the presentation is quality of anesthesia induction and anxiety levels among the children. So why we did this audit? Basically, the background of it is some observation made in the hospitals. We realized that the moment the doctor approaches a child, basically it's either to examine, it's either to take samples or to uncover the child for some monitoring, and the children are scared. And also apart from this, there is a general global awareness about the psychological impact on the child. So this is one of the situation which happens if you are not doing a good induction at the time of anesthesia. The child is scary, is thrashing around, mother is almost about to faint. And this is not happening only at the site. Apart from that, apart from this acute impact, you have a chronic impact. In the theater, you require more anesthesia drugs, you require more analgesics, the length of stay is more, the finance is more on the hospital and patient, and in long term, you get a child who is depressed and has got a lot of negative behaviors. So we started off the study audit with to find out the incidence of poor quality of induction, to find out the factors which are responsible for it, and based on that, we wanted to make some changes in our practice. So, so the workflow for this audit was we went to IRB, got the approval, we audited, the audit period was 2 months, sorry, and we took informed consent and verbal assent as it was appropriate. We recruited 103 patients and analyzed data for 78 patients. We included 2 to 15 years children who were inpatients and those who were coming for minor procedures. The principal investigator went to the ward one night before, interviewed the child and the mother as appropriately, and scored the anxiety scores both in the wards, holding bay on the day of surgery, and also in induction room. Sorry, it's just going. Okay, so we got our outcomes of the audit, and we realized the incidence of poor induction in our setup was around 30.77%, which was a bit higher than the Western population scores we have, which is around 25%. So, so now we'll started to look at the factors associated with the poor induction. We figured out the age group of 2 to 4 years, the children who have got already white coat fear, and the children who are going for inhalational induction had higher induction compliance checklist scores, which means there were poor induction happening for them. And the sedation, child's acceptancy for the surgery, and distraction techniques were actually lowering these scores. We also realized that at that time of audit, we were practicing almost 95% of all the patients who were getting pre-medicated, and we were not using distraction techniques to the best level. We got the anxiety levels, and the scores were highest at the time of induction. We decided to take steps. First, we decided not to pre-medicate all the patients by default. So we changed the practice. We started bringing down the patient a bit early. We started analyzing. We have a holding bay which was decorated better, made it more kids friendly. We have an induction room which is a little more better than before. We give them few toys to play around, give them 10 minutes to settle. Now after that we approach them with a smile. Smile makes the difference. We approach them with a smile, and then we ask them, do they want to have more toys? We don't keep all the toys there. We keep some as a surprise for them. And the children who agree to come with us inside the theater and say, no, I want to choose my toys. So they are the ones, we know that separation anxiety is less, so these are the children who will not need pre-medication, whereas the children who are not talking to us, we know that they need pre-medication. So at this stage, we pre-medicate them. This is just to show some pictures how they are getting distracted by engaging, by utilizing technology. We all have WhatsApp, and we just show them some videos. I've got my mobile just to show that we have covers like this to attract them. We have our friendly staff. Technicians are playing vital role, and sometimes they induce the child for us. So we decided after that to have a feedback from anesthetists, surgeons, and also the nurses. And the anesthetist opined that smoother induction, less headache, calm parents, not fainting parents. The surgeons felt the children are more at peace in the wards post-operatively, they are more comfortable, and the nurses felt that children are walking into theatre no more on the stretchers, they are more comfortable
Time is up.
kids, and that's all about the audit we did.
Thank you. Have you heard of the surgeon who reassured the patient? Why are you nervous? Is it your first surgery? Look at me, I am not nervous. It's my first surgery too. But wonderful topic. One question.
So we try to take, we don't sterilize, we just clean them, we wash them regularly. At the end of the day, all the plastic stuff, we wash them carefully. All the soft toys, we try and avoid giving them. We have some soft toys kept in the room, we try and avoid giving them those toys to them. But the plastic ones are what we give them. We don't sterilize, we just clean them at the end of the day. Yeah. So this is an audit, so we didn't have control group. We actually audited for 2 months, and the scores, we have validated anxiety scores, we have validated ICC score, which is Induction Compliance Checklist score, so which is what we used, and it has got some 14 points. It's a little too much to describe here. Yes,
Thank
sir.
you. I think we are run out of time. Is that okay? Sorry. We'll go on to the
Thank you.